Hey everyone, welcome back to my channel. It's Dr. Alessandro. Thanks for joining me. And in this video, we're going to be talking a little bit about dental labs. Now, I would like to film a video with a dental lab at one point or another, or with the manager or owner of a dental lab. But I'm going to be talking a little bit about how to find dental labs. That's one thing. And then you could say communication with dental labs and what happens when things aren't really working and how to express that. So first off, how do you find a dental lab? Well, a good way to find a dental lab is to ask friends who have had good results with dental labs. Ask them, hey, which dental lab do you guys like? What do you like? Which one do you use for, say, your removable, your partial dentures or dentures? Which lab do you use for your crowns, bridges, implant work? Ask around. See if there's some sort of a consensus. If a bunch of people say, hey, we all send it to this lab, or, for this kind of work, I send it to one place, but for maybe your anterior front teeth, you send them to another. Find out, and then you can try them out. You can contact the laboratory and see if they want to work with you, send you a few boxes or something, and then maybe they'll even give you one case for free. You never know. It never hurts to ask. But anyway, try them out and see the results that you get, because you never know. I mean, some labs may really surprise you. I currently work for Crown and Bridge. One of the labs that I use, at least, is a lab called Maplewood Dental Lab, and they're in Minnesota. Now, these guys are great. I've had really, really good luck with them, but not really luck. I mean, they're skilled. They do super work. So I'm happy to work with Maplewood Dental Lab. And for some of my anterior cases, the ones that maybe need to be turned around a little bit faster or need a little bit of a better look, and depending on the case, because Maplewood does a good job, don't get me wrong, they do a good job for my anterior crowns too, but I use a local lab called Toothsmiths. They are a super lab, all right? So I am thrilled to use Toothsmiths for anterior work because generally speaking, they hit the ball out of the park. So Toothsmiths in Lititz, Pennsylvania, great lab to use for your anterior type of aesthetic work. The lab owner, Jim, I know that he's still doing some cases. He may have kind of cut back a bit, but he did exquisite porcelain work. So he might even do it. If you request them, he may be able to do it for you. But he has done some really, really impressive stuff. That said, so that's kind of how you find dental labs. You ask around, you see who uses what. Now, communication with the lab, always be polite. So when you're writing on your lab slips, always do the please and thank you, okay? That's a good thing. Try to include as much detail as you can, if it warrants detail. So if a patient has crossbite, of course, the bite registration that you send will help, but hey, patient has crossbite, maybe watch occlusion because patient is a strong biter. If they have very, very powerful bite, that's something that a lab maybe should know. And maybe they can tell too by the wear facets on patients' teeth on the stone models that they pour or on the scans that they do, depending on what they do. So it's important to communicate details like that. Or if it's an anterior case, communicate details. Better yet, send pictures. If you can send photographs for anterior cases, that makes a huge difference. So sending pictures with at least 1 or 2 shade tabs, preferably 2, is a good thing. And that way the lab can work it. Some labs even have a custom shade room in the event that an anterior case is a little bit tricky. So sometimes they can actually bring a patient into the lab and do a custom shade in the lab. That's a great service if that's, something that's possible for you. That may or may not be possible depending on how far you're sending your cases. But those are all things that you can do with a dental lab. Now, what are some pitfalls? Okay, so sometimes communication can break down, and some laboratories, and again, this is one that our practice uses. I'm not going to name names, but sometimes if they become maybe too corporate, say something along those lines, something isn't quite working well, you get breakdown. Okay, so for example, it should not take 45 minutes to adjust a crown. Let me repeat that. It should not take 45 minutes to adjust a crown. So if that's something that's happening with you on a routine basis, or you notice that maybe it's not every time, but every other time, you're getting a crown back that requires a ton of adjustment, and you've already communicated it with the lab, and you don't see improvement, that is, they're still sending back every other case, or maybe even every case, where it's taking 20, 30, 40 minutes to adjust a crown. That's unacceptable. It should take maybe 10 minutes max. 10 minutes a 15 on a tougher case, okay, that's okay. But other than that, it really shouldn't take that much. So if you're finding that that's what's happening all the time, maybe you should fire the lab and look for a new one. All right. I'm not firing the lab necessarily today, but I am going to show you, and I'm going to hide the name of the guilty as it were, but I'll show you that because we use the lab, it is something that we spend a fair amount on. I'm sending him a little note because I am not thrilled with the fact that a couple of crowns recently have required a lot of adjustment. This is not Maplewood though, so don't get me wrong, it's not Maplewood. They're doing a great job. I'm very happy with them. And again, they're in Minnesota, so I'm from Pennsylvania. I find their accents on the phone different, and of course, I enjoy listening to that. And they probably all put me on speakerphone and listen. Hey, there's the guy from Pennsylvania calling, and they all crowd around, probably listen to my voice and think that my accent sounds kind of different too. But they are super folks, very, very friendly, wonderful to work with. So it's a free plug for them. I know that, and I'm happy to give it to them because they do such a good job. Same thing for Toothsmiths and Lititz with their anterior work. Grand slams. I've done super bridges, super crowns with them. Thrilled with them. Can't say enough good things about them. Can't say enough good things about their lab mascot dog that they have named Kilo, who hangs out in there. Again, I want to talk highly of labs, and I can talk highly about those two labs for my fix, that is my crown and bridge, and Harrison Neal in Harrisburg. They've done a very solid job for me for 13 years, or more actually. And so that's a good lab for removable. So if you want to do some solid work with removable, Harrison Neal has done a good job for us and continues to do so. I've been pleased with their work, and so they really do their best, and I think that they are a worthwhile lab to work with. So Harrison Neal in Harrisburg, actually they're outside of Harrisburg. They're actually in Hummelstown, Pennsylvania. So look them up, Harrison Neal. If you want to try a case with them, by all means, please do. All right, so that is the video for today. Hope that has helped you out. So mainly for younger docs or maybe dental students who want to know more about how things work on the outside. But plugs for labs that I've worked with that have done a really good job. And I appreciate their hard work and their talents. And I hope that they continue to do a good job for us and for everybody that sends the cases. So thank you so much for joining me, and I hope you're all staying well and healthy.